Welcome back. It's exactly 1 after 9 o'clock, and a reminder that this hour of news and views is sponsored by African Muslims Agency. African Muslims Agency, a beacon of hope to communities for over 35 years in Africa and beyond, and some very exciting news for one and all. Yumna Al Sayed media and journalism tour is starting right here in South Africa on the 21st of August. And of course, it will end on the 1st in the Western Cape. This, of course, is an initiative of Salam Media in support of families of fallen journalists in Gaza. So do remember those dates. It starts on the 21st of August in Johannesburg and will be ending her tour on the 1st of September in the Western Cape. For more information on the tour, the media and journalism tour of Yumna Al Sayed, please go to our social media platforms and get all of the necessary information and get the dates of when she will be visiting your area. Right, let's move along now. And I'm looking forward to talking to my guests, but I'm not looking forward to the subject matter at hand because this takes me back to pre and post COVID days. The World Health Organization is considering declaring Mpox a global public health emergency amid rising cases in Africa. So let's hear just how serious is this matter. Is the medical fraternity viewing it as they viewed the COVID pandemic? Or are they going to put us at ease and say to us, take precautions, but no need to be overly concerned? Senior research scientist, Center for Lung Infection and Immunity, that is at the UCT Lung Institute, Dr. Shameem Jaumdally. Assalamu alaikum to you. Long time no speak. Wonderful to be chatting with you once again.
I don't know if I need to say it's always a pleasure to talk to you because we're always talking about all these infectious issues, but inshallah, I will shed some light on the topic that we have for today.
Ameen, thumma ameen. And yes, you and I had very many conversations during COVID, pre and during and post COVID. And it was, of course, absolutely heartbreaking knowing that I don't think there's a family globally that hadn't lost a loved one, either an immediate family member or a relative or a member of their community. So what exactly is the story on Mpox? I spoke just when we heard about the first few cases that had come to the notice of the authorities. I spoke to the Center for Communicable Diseases here in South Africa, and I was rest assured, as I was pre-COVID, that there isn't really anything to be concerned about. There was perhaps just one or two known cases in South Africa, and it seemed to have emanated in Africa. And perhaps 6 weeks or 2 months later, the situation seems to have changed. What is the situation as you and I currently speak?
Yeah, and just to take you a little bit further back in time, Judy, this whole monkeypox global epidemic started around 2 years ago in 2022. And yeah, as you said, it's not been a matter of concern as much as COVID at that time. And that's mostly because of the numbers that were being reported. But in epidemiology, which is basically the study of trends of diseases, whether they're infectious or non-communicable, we look at transmission, at numbers, and moving from 2022 to 2024, the WHO has decided that it may be time to sound alarm bells because what we're seeing now is that there are much more terrain and many more countries that are covered with monkeypox cases being detected, and not only monkeypox cases being detected in people who have traveled out and come back to the country, but also transmission that is now starting to happen within the country. And I checked the numbers with the NICD this morning, and as of today, this morning, we now have 24 cases that have been registered this year. And there were two more cases over the week now that have been picked up, one in Gauteng and one in KwaZulu-Natal. And of those 24 cases, there are 3 deaths that have results. And I think the danger, especially for South Africa, is that monkeypox, yes, it's an infectious disease. It causes disease and a state of illness, but it can become more severe and it can lead to death in people who are especially immunocompromised, which means people who have a poor immune system because of some illness that they have. And we know in South Africa that we have one of the highest prevalence of HIV/AIDS in the world, and that counts as a very large portion of vulnerable people. So in a sense, I think more countries now reporting the infection, and more countries reporting inland transmission. So transmission from people who infected to another people within the country is what is causing all the alarms that are starting to ring.
So during COVID, I mean, we went on this massive safety campaign where we were washing our hands all the time, we were wearing masks, we were isolating, and everything else that went with COVID. A terrible, terrible time, not only for us here in South Africa, but globally. And as I indicated a little earlier on as well, that I don't think there's a family or a community that, didn't have a loved one that had passed on due to COVID. What does this picture look like? Are we going to reach those proportions again regarding masking up and, washing? Look, I mean, I think washing of our hands on a regular basis is good hygiene practice. But regarding how this is being communicated, what sort of precautions ought we be taking? And knowing that currently we're only talking about 24 cases that have been registered in South Africa, is that saying that it's not a cause for concern, or is it time to start taking the necessary precautions?
I don't want to stoke fear in people, but at the same time, I also don't want people to be complacent about precaution, right? So when we compare diseases, we also have, especially when it comes to infectious diseases, we have to compare how they get transmitted and what are the risks involved. For people like us in the medical community, we always evaluate risk. And if you remember back to COVID times, COVID was extremely infectious because it was a respiratory virus that could be very easily transmitted to people, and through coughing, sneezing, some people say breathing, talking, singing, and with monkeypox, it's a bit different. With COVID, the exposure that you get is a high risk exposure, okay, to somebody who's been infected and who's confirmed to be infected. With monkeypox, it's not the same. Monkeypox is mostly transmitted through contacts, so that means touch. And we also know now from reports with more cases that are accumulating during this current outbreak that we're having, that a single contact or a few contacts do not necessarily, contacts obviously with people who are infected do not necessarily lead to somebody else, that person in contact now getting infected. So in terms of comparator, of comparison with COVID, I don't think we are going to sit with a situation that will go global, that will go as deep within our society as we've known it with COVID, with monkeypox. But yes, we need to be careful. But I think it's more people who are exposed. We need to inform people about how to actually know when to go seek help. With monkeypox, it is mostly a manifestation of skin scabs, So it's very specific. But of course, in the earlier phase, you will get the usual symptom that comes with infectious diseases, which is your fever, your myalgia, which is body pain. You may have some discomfort, in your stomach, your intestine. But what we need to understand is that most people who are infectious are actually people who have already manifested those skin scabs, those lesions that comes with monkeypox, and that it's mostly through contact that monkeypox get transmitted. Right now, the case count is actually quite low. I think the main concern in Africa, because when the WHO is talking about sounding the alarm, it's mostly for the African continent. Because if you look at the epicenter right now in the continent, which is the DRC, the Democratic Republic of Congo, we are at a stage now where the numbers that are getting picked up and confirmed right now is almost twice the number that we were getting last year. So it is a sign that the numbers are increasing. But the problem in Africa also is with regards to resources and facilities that we have to test people. And just to end maybe on that before we move on to your next point, as opposed to COVID, we do actually have certain antiviral, which are medication that attack the virus directly, which are effective. And I understand that there is one now that's called tecovirimat, which has been donated by the WHO to South Africa and many other African countries that can be used to treat people who have been diagnosed with monkeypox.
Okay, so Dr. Shameem, a couple of questions then regarding mpox. Is there going to be a situation like with COVID? And excuse my referencing to COVID all the time, but would it be a similar situation where we're going to be looking at the possibility of vaccinations, or is that not necessary? Question number one. And what sort of we spoke about COVID being a respiratory virus. Would mpox fall under the same, heading, so to speak? How will we know that there is a possibility that this is, because of the numbers being so low in South Africa, of course, that, goodness me, I think I might be presenting with mpox?
So, as I said, I think it builds up. Let me answer your second question first. I think it builds up. As I said, when you have an infectious disease, you have common symptoms like fever, your body pain, your headache, your fatigue, especially that comes with viral infections. And the most defining symptom are the lesions that develop on your skin. And I think when that develops, that's when people realize, okay, there's something that's definitely not right, and maybe I need to go see the doctor. Now, when it comes to the vaccine,
can I just interrupt you there? I just interrupt you there? You talk about skin lesions. Would they present in a particular part of the body or anywhere on the body?
Generally on your hands, on your belly. So there's no specific parts that I understand these lesions present in generally. But they are very characteristics. They scabs, and what normally happens is these would normally last between 2 to 4 weeks, and we actually then only count somebody as not being infectious anymore when all these scabs have fallen and a new skin has actually grown back on the body of the person. So for as long as these scabs are still visible on somebody who has actually been infected with mpox, they are infectious. They need to stay in isolation. They need to take the medication, as I told you now, that is available, that has been donated to South Africa and many other countries. And once they've completed their treatment and they are safe to come out, they can come out. With regard to the vaccine now, what I understand from my reading is that the vaccine, it doesn't work like for COVID. The vaccine can still be administered to somebody who's already been infected. The vaccine is not meant to prevent monkeypox, but it's meant to actually make sure that the disease that results from the infection does not hit the severity that puts the life of the person at risk. So right now, you can imagine that it's something that is called an emerging disease. It's pretty new still. There are not many vaccines that are available on the market to administer to people. So the strategy that's being used right now is to keep it for people who've been confirmed, maybe some people who are really immunocompromised and vulnerable and who may be more exposed to monkeypox. And these are the people who are going to get that now. I don't think we will go into a vaccination program like we've known for COVID, where everybody will need to be vaccinated against monkeypox.
Okay, so my final comment is I've heard, speaking with other medical practitioners, that people most at risk to contract mpox are people who indulge in same sex partnerships. Obviously, so we're talking LGBTQ plus community are very much at risk. Does that then kind of almost send out a message for other people not to take extra precaution? And that's what worries me, because I'll sit here and think, well, I don't belong to that particular community. So my family and I are relatively safe, or we're very safe. So I don't have to take precautions. And what would those precautions be?
Yeah, you're right. I mean, we have heard report now that it is an infection that seems to be more commonly diagnosed in people who indulge in sexual contact with people of the same sex. There's still not enough evidence to confirm that it's just something that has been observed. We don't know the science behind why this is so. It could be multiple contacts that lead, like having more partners, and therefore more contacts that lead to these people being more at risk of infection. But as you said, when we talk about contacts, contact is it's not just sexual contact. We shake hand with people, we meet people, we care for people, in old age home, in hospitals. So we therefore all at risk of getting monkeypox to some extent. Right now, I don't think there is any specific precaution that is being advised for the general community. As you can imagine, the numbers are still quite low. As you said, I think the whole point of hand hygiene still holds, even after COVID, because it helps us to ward off diseases that are infectious, whether it's flu, whether it's COVID, whether it's gastrointestinal in nature, like your gastro and other microbes that can cause diarrhea and vomiting. So I think at this stage now, I think the hand hygiene is the most important. As I said,
Okay.
it's not something that is respiratory in nature, it's a contact disease. So keeping a good hand hygiene would probably be the best precaution that we can take at the moment.
Dr. Shameem Jaumdally, Center for Lung Infection and Immunity. You are, of course, the senior research scientist there at UCT. Lovely talking to you. Go well, keep safe, and I hope there won't be a next time, because when we do talk to you, it's about these serious issues. But you keep safe.
Yes.
Nice chatting.
Inshallah. Salam.
It is exactly 9:20 a.m. News and Views on this morning, right here on Salam Media. Our next guest is standing by. He is Jefferson Alistair, and he is a community activist. So we do hope you're going to keep us company for the rest of this hour, inshallah.